Hey everyone, so today on the Vilissa Show, I'm going to be interviewing a lady called Swati, who is a registered nutritionist and a functional medicine practitioner. We're going to be talking about all things diabetes, so it's really exciting as I've started my diabetic journey. So let's head over and see what she's got to say. And welcome to the Vilissa Show. Thank you for joining me. And can you tell us a little bit about yourself and your background?
Sure. Thank you so much, Melissa, for having me today on your show. It's my privilege completely. So about myself, my name is Swati. I'm a registered nutritionist and a functional medicine practitioner, and also a founder of my brand called Nutricientist. So I have been into nutrition consultation business for about 10 years now. I worked in different areas. I worked in hospital setting, in a corporate environment, and also in a private clinic as well. And I've worked a lot with GPs on their clients who've been having type 2 diabetes or who've been diagnosed with pre-diabetes. And then I do a lot of work with corporate people as well, as in with the weight management, or again around type 2 diabetes, or if they just want to prevent any disease in the corporate environment. And specifically my areas of specialization include hay fever, intolerances, type 2 diabetes, pre-diabetes, hay fever, and also hormonal balance, specifically with women. So that's about me.
Perfect. So today, because you do so much, we're going to actually focus on diabetes, because obviously I'm talking about my diabetes journey, and then hopefully we'll be able to welcome you back to the show at a later date to talk about other stuff as well. Like you said, things like the hay fever and stuff, and intolerances, which is absolutely great. And I know a lot of people will want to know about that. So the first question I've got to ask you is, what are the different types of diabetes? So for people that don't know what diabetes is, or maybe have no clue that there's different types, what are the different types of diabetes?
Sure, very good question. Before I get into what are different types of diabetes, let me just talk a little bit about what is diabetes and how does it all start. So when you eat carbohydrates, it gets broken down into sugar and it enters your blood. And your body is really clever. So it's got organ called pancreas, and at that point, it releases a hormone called insulin. And the job of the insulin is basically to clear all the sugar from your blood and send it to the cells. And cells use that as a source of energy. So it goes to different cells, so liver, muscles, adipose tissues, so different cells basically, so that it can be used as a source of energy. Now, if you have diabetes, let's start with type 1 diabetes. So your body is not producing this insulin at all, okay? And then you have to take insulin injections from external sources, basically. If we talk about type 2 diabetes, your body is still making insulin, but it's not making enough insulin. So you might go into a combination of some medication or insulin or just diet and lifestyle to handle it. And before the type 2 diabetes starts, you're basically, there is a different stage, which is called pre-diabetes, which once gets diagnosed, it's very easy for you to reverse it. So pre-diabetes is a stage where your body is making insulin, but again, not enough insulin. And your cells over a period of time start resisting that insulin. So they say, that's it, we don't want any more insulin. And then your body registers that and it starts producing low amount of insulin over a period of time. And once it goes over a longer period of time, then it gets diagnosed and it develops into type 2 diabetes. There's also something called gestational diabetes as well, which is, again, something similar to type 2 diabetes, where your body's not producing enough insulin, but that happens during pregnancy. Generally, people, it just disappears, or, it gets reversed once the pregnancy is over. But again, it depends on what condition you had or how well you controlled it during your pregnancy.
So we're going to talk about the different types and things you can do. But if you are told you're pre-diabetic, what changes or slight changes could you make that could sort of prolong you becoming a full type 2 diabetic or anything like that?
Sure. As I mentioned, that pre-diabetes is a stage where it's really easy for you to reverse that stage rather than developing into full-blown type 2 diabetes. There's lots that you can do around your diet and lifestyle. So if I start with the diet, I would say focus on healthy diet in terms of having lots of whole grains in your diet. So things like quinoa, amaranth, buckwheat, teff, lots of green leafy vegetables as well. Cut down on the starchy vegetables like potatoes, corn, and peas, but just concentrate on green leafy vegetables. Fruits you can have, that's fine. So that is the whole grains. That is a really good source of fiber as well. And fiber, basically, the job of fiber is to promote satiety, and it also balances your blood sugar level over a period of time as well. It's good to have a good amount of fat in your diet as well, but it's important what kind of fat you are choosing. So opt for fat which is good quality fat like avocados, seeds, nuts, and you can use things like ghee, coconut oil, or olive oil for cooking. Just stay away from processed foods, that's what I would say, because they are high in sugar and fat. And also the other thing I want to mention here is something called GI. So basically, GI is the glycemic index of foods. So when we eat carbohydrate, as I mentioned, it gets broken down into sugar. And it depends on the GI, which is the glycemic index of the food, how quickly it will break and release the sugar in your blood. If it's high GI foods, so things like cakes, pastries, and stuff, it will quickly release the sugar in your blood, and then there will be a quick dip in your sugar levels as well. So opt for low GI foods like oats, barley, green leafy vegetables, fruits, things like that, so that you're able to maintain your blood sugar levels over a period of time. The other thing to look for is having lots of protein in your diet as well, because again, protein promotes satiety and it balances your blood sugar levels for a very longer period of time, and it keeps you feeling fuller as well. So you're not going for snacks in between your meals.
Yeah.
The other thing that you could do is intermittent fasting. That is, again, quite beneficial. So intermittent fasting means that you are fasting over a longer period of time, let's say about 10 to 12 hours, and you're only eating within a shorter window, so maybe about 8 hours. So what that does is, when you're not eating, your body does not have to produce any insulin levels. So basically that will help in reducing the insulin levels, and it also helps in maintaining your blood sugar levels over a period of time. So that is about the diet. When I talk about lifestyle, I would say physical activity is really important. So be active as much as possible. That is to prevent the diabetes or pre-diabetes. But one cautious thing to keep in mind is that if you are diabetic or you're taking any medication, just best to let your doctors know that you are going to be going on a physical activity regime, because if you're doing too strenuous exercise and you are taking some medication as well, you don't want your body to go into hypos. Yes. So that's one thing to keep in mind with the physical activity. The other thing, very important thing, is managing stress as well. Stress is a natural phenomenon. Anyone can go through stress basically. When you are stressed, your body produces a hormone called cortisol, which is again a very important hormone, because that's the hormone that gets you out of the bed in the morning. Yeah. So, and it also basically produces a fight or flight response. If you are in front of any danger, you need the cortisol hormone. But over a period of time, if there is chronic stress, your body produces too much cortisol. And what that does is it has an impact on the pancreas. So it forces the pancreas to reduce amount of insulin over a period of time. Or it can be reversed as well. Your body starts producing too much insulin. Your cells again start getting sensitive about that, and your body goes into pre-diabetes mode. Over a period of time, it's not, if you're too much stressed and you're not able to manage your stress levels very well, then your body can go into pre-diabetes or type 2 diabetes. So these are the things that you could do. So the diet and the lifestyle, basically.
And you mentioned hypos there. Can you just explain that? Because there are people that won't understand what hypos are, and the fact that, you know, you can have too much insulin, but you can also have too little insulin, which could have a reverse effect on you. So could you just explain that for me?
Yes. So hypos is basically, as I said, that when you eat carbohydrate, it releases sugar in your blood. So your blood sugar levels have to be maintained over a period of time. We say normally if you're not eating and you test your bloods, then it's between 4.5 to 6.5. So that's what you're looking at, the target. It can go up to 7 as well. But if it goes anything below that, that means that you're going into hypos, which means your blood sugar levels, there's a dip in your blood sugar level, and you need to get yourself checked. That's one thing if somebody has not got diabetes, but if you've got diabetes, you have to be really careful of what sort of medication you're on. So sometimes we do different diets. So we go on low carbohydrate diet, but our insulin levels is the same as in the injections that we are taking, or metformin if you're taking as a medication. You need to get that adjusted as well if you're changing your diet. So it's very important if you go on a specific diet or on a different physical regime, or any changes that you're making in your lifestyle or your diet, it's best to let your doctor and your nurse know so that they can adjust your medication as well, so that there's not a sudden dip in your blood sugar levels. Because if you go into hyper, it's very risky for your body. You can faint as well. There could be blackout, and if there's no one next to you, then it could be risky for your life, basically. So yeah, it's best to just get it checked if you're making any changes in your diet and lifestyle.
Yeah, so not to go straight in and just go onto a diet thinking it's all going to be fine. Make sure you speak to the doctors and see what they can do and what they suggest first. Yeah. So what are the telltale signs of diabetes? So if you don't think so when I was diagnosed with diabetes, I had no idea. I was only 30 years old, didn't think that it was even like, a little glimpse in my future. What are the telltale signs for anyone that might think that it's just something else and there's nothing wrong with them and they don't want to go and get checked? What are the telltale signs?
Yeah, I mean, that is very common, especially with youngsters. They don't realize that, they can't really think that it could be diabetes or they can get diabetic. But it's becoming very popular even in children as well. So it's really important for us to educate right from the beginning, right from the childhood, what sort of things to watch out for, because diabetes is becoming very, very common in the Western world. So I would say if you are having frequent thirst, frequent urination, if you go using the toilet quite frequently, if you're feeling tired and lethargic, because sometimes we think that we've not slept very well or we're partying too much, that's fine. That could be one of the reasons. But if you've got other symptoms attached to it as well, it's best to get it checked from the doctors. So if feeling too much lethargic or loss of energy, and especially in women, if there is frequent episodes of thrush, that could be a sign as well. Blurred vision, or if there is unintentional weight loss, specifically with youngsters, we think that we're not doing anything, but we are losing weight. It's a good thing. But if it's unintentional, you're not doing anything, I would say it could be a sign. So just get yourself checked. It's just a blood test that they need to do.
And how do doctors determine what type of diabetes you have?
Yeah, so they do a urine test and a blood test, which will give them a figure on blood sugar levels. If they think that you could, they would ask you a lot of questions if it's in your genes, or as I mentioned, the symptoms. Then they would ask you to do before eating and the postprandial. So postprandial is after eating, so 2 hours after eating. So they might ask you to do both the test and the urine test as well.
Okay, and then what medication is offered? So obviously type 2 and type 1 are different, you get different medication. What is the most common forms of medication that you can take?
Yeah, so specifically for type 1, because your body is not producing any insulin at all, so you have to take it from external sources. So usually you are put on insulin injections. Type 2, it depends what stage you are at. If it's the beginning, the doctor will ask you to make certain modifications in your diet and lifestyle. And it's very easy from type 2, the beginning of the type 2 and the pre-diabetes stage, it's very easy to reverse it. So you can easily go into remission. So change in the diet and lifestyle, but if they think that it's gone beyond that, you've tried everything, they might put you on medication, which is called metformin, or any other combination of medication as well. But if it's over a longer period of time and you're not able to, you've tried everything, you're not able to even control your blood sugar levels with medication, then they might think of doing a combination of medication and insulin.
Okay, and so I know we talked about lifestyle and sort of food changes that you could make if you're pre-diabetic. Is that the same like that you would imply if you've got type 2 diabetes? So would it be the same thing?
Yeah, that's right. Absolutely right. But again, as I mentioned, what stage of diabetes you are at. If it's just the beginning, then the diet and lifestyle would make a huge difference, and it's very easy to reverse it. And you can actually do it on your own as well. But if you're on any medication, just discuss it with your doctor beforehand, because obviously they will need to adjust your insulin levels, or even if it's the metformin, they will have to adjust the dosage as well. So just let them know that this is what you're thinking of doing, and so that they can track your progress accordingly.
And what are the long-term complications of diabetes? Because that's something that I think people don't, that's why they don't take it very seriously. Because they don't think that it, okay, I'm diabetic, I'm taking some medicine, that's fine, but there are long-term complications. So what are they?
Absolutely right. There could be long-term complications if you are not managing your diabetes very well. And that's why if you're diabetic, then you would know that the doctors ask you to come for regular checkups. So the long-term health complications could be things like heart disease and stroke. It could be nerve damage as well, or it would have a major impact on your eyes. So you could have blurred vision, or even eye loss, the vision loss as well. Or it can damage the kidneys if it's not managed really well, and your body is still producing too much blood sugar levels. Foot problems, or if you're pregnant, then it's absolutely must to get it checked and let your doctors know that you're pregnant right from the beginning, because if it's not maintained or if it's not controlled very well, it can lead to miscarriage or stillbirth.
And for anyone at home that's watching this and thinks, oh, I might be diabetic, my grandma's got a glucose tester, I'm going to use it just to check, before I rush off to the doctors, what should the levels be?
Right, okay, so you could check it 2 times. So one is before eating. So if you're doing it before eating anything, then it should be between 4.5 to 7 millimole. And if it's anything higher than that, obviously it's best to get it checked. And you also check it 2 hours after eating, which is called postprandial, which is after the meal. And it should be not higher than 8.5 to 9 millimole. So if it's out of those ranges, then obviously it's best to get it checked. If you have the HbA1c checked, so let's say you've got pre-diabetes or insulin resistance, and you get your HbA1c checked every few months, then it should not be above 48.
48. That's quite funny that you mentioned that, because I went to get my little piece of paper that had HbA1c written on because I couldn't remember what it was called. There you go. So can exercise help reduce your glucose levels?
Absolutely. It's really important to be physically active, as I'd mentioned before. You could do any kind of exercise that you want to do if you are at the pre-diabetic stage. But as I'd mentioned, if you're taking any medication, and if you think of doing any strenuous exercise like 5K run, or, you know, like even if high intensity training and stuff like that, just speak to the doctors, and so that they can adjust your insulin levels. Because when you exercise, your muscles, basically the insulin level works, and whatever insulin you're producing or the medication, and it clears the blood, and there's an uptake of that blood sugar into the cells, and it specifically goes into the muscle cells. So if you're doing exercise, then it will quickly remove that from the blood and move it into the muscle cells to be used, so that you can continue doing your exercise. So, and if you're imagine if you're taking medication and if you're not adjusted it, again, there could be a high chance of you going into hypos.
And here's a question, which I think is quite a common question, especially if you're a bit younger and you think that it's not a possibility. If you are diabetic, do you have to stop eating all the food you love? Because I feel like some of the younger people watching this might think, I don't want to find out if I'm diabetic, because it means I can never eat a piece of chocolate again. I can never eat a piece of cake again. That's not actually the truth, is it? So would you like to explain that?
Absolutely. A very good question, but not a straightforward answer, I would say. It depends on what stage of diabetes you are at, and also how well your levels are controlled. But what's coming into my mind is I've had a lot of people who come to me and think that they are on medication or they're taking insulin. It's okay to eat whatever they want to eat, but it doesn't work like that. Even if you're on medication or on insulin, if you're not still maintaining it very well, and we've mentioned that there could be long-term health complications. So if you are managing your blood sugar levels well, you're doing whatever your doctors ask you to do, it's okay to indulge in treats once a while. So it's not that you can't have it, but just, you know, compensate it with what other meals that you're eating in the day, and just manage it overall very well with your medication or diet or lifestyle, whatever you're using to manage it.
Definitely. Now, something that we're going to move on to, you mentioned it earlier, and I was actually talking about it the other day as well, is pregnancy and diabetes. Because there's two things. There is, you could potentially get diabetes when you become pregnant, and there is, if you're already diabetic and you want to conceive, there are extra sort of complications that are involved. So if you are diabetic, is it harder to conceive?
It shouldn't be harder to conceive, but if you're still having problems, it's just best to speak to your doctor and find out, you know, if it's again, as I mentioned, if it's not controlled very well, and if they have to increase your medication for any reason, so it's just best to speak to your doctor or your nurse about it.
And what measures should be put in place if you want to try and conceive and you're already diabetic?
So if you're trying to conceive, as I mentioned, that make sure that you are doing what your doctors and nurses are asking you to do. If you are making changes to your diet and lifestyle, it's really good, you know, but just let them know if you're on medication. Just make sure that you are having your regular checkups done as well, as I'd mentioned, because if you're not getting that done, you wouldn't know that, you know, if it's going into any other direction, or if it's leading to any other long-term health complications. So best to get that checked. When you think of getting pregnant, even for anyone, even if they're diabetic or non-diabetic, I would say that they should go on something called folic acid, basically. And specifically, if you are diabetic, then they would increase your dosage as well. So if somebody is going on 10 micrograms, they might just increase it to 50 micrograms for you. So 5 milligrams of folic acid right from the day when you think or you plan to start conceiving. So that would help you as well, and the baby, who is the unborn child, because that prevents the baby to get something called spina bifida, which is to do with their spinal cord. And also it will help them to prevent or reduce the risk of them getting diabetes as well. And again, just get your eyes and kidney checked regularly. Make sure you're having healthy lifestyle. Other thing to note is just, I would say, quit smoking and alcohol. There is a lot of debate around there. Some people would say it's okay to have a little bit of alcohol, but I would say there's a lot of research being done around that, where it says that, there is higher chances of complication if you take alcohol. So just stop it completely right from the day you think or you plan to start conceiving, basically.
So you mentioned the alcohol already. Is there any other foods that you should eat or avoid if you are planning to conceive or if you're already pregnant?
I would say specifically to eat, it's just whatever we've talked about. Focus on the whole grains, eat good protein, fat. Just don't think that fat is bad, because even if you were not taking any fat before you got pregnant, just think that fat is not bad. It is an essential component for, which performs many body functions. It's important for the cell membrane. It's important for your baby as well. But just opt for the right good amount of fat and the good quality fat as well, like avocados, nuts, and seeds. And stay away from processed foods, which are high in sugar, salt, or saturated fat. But otherwise, just normal healthy diet and lifestyle. Just try to manage your stress levels, be active as much as possible, and sleep well. Things to avoid, there are quite a lot of things that you have to avoid, not while conceiving specifically, but if you are pregnant. So things like mold, cheese, the blue cheeses, any unpasteurized dairy like milk and cheeses, liver and liver products, because they are high in vitamin A. And if you take too much vitamin A, then it is being linked with the risk of miscarriages or stillbirth. Raw or partially cooked eggs. And if you're taking fish, it's really good. It's a good source of omega-3 fatty acids, but go for oily fish. So things like salmon, tuna, but not more than 2 portions of oily fish every week. And avoid things like swordfish, marlin, shark, and raw shellfish.
I'm glad you mentioned that, because of course there are people here where they'll be watching this, they're not diabetic or anything, but this is good advice just generally for anyone that's pregnant or thinking of getting pregnant. Now there is that diabetes that you can get where you get it once you're pregnant. So do you want to tell us a little bit about that?
Yeah, so which is called gestational diabetes. So again, your body is producing insulin, something like type 2 diabetes. Your body is producing insulin, but not enough insulin to meet the extra needs of pregnancy, so which is called gestational diabetes. And anyone can get that, even if it's in your genes or not genes, but anyone can get that. They've not found out what could be the reason. It's a lot to do with your lifestyle, diet, or genetic as well. It's very easy to come out of it. So normally once once your pregnancy is over, you've given the birth, it normally comes, it reverses and you get out of it. But there could be chances if you didn't manage it very well, and if it was not well controlled, then it could stay with you for the entire lifetime as well.
So with gestational diabetes, how would you know after giving birth whether you still have it, or would the doctors just tell you whether you need to still take the medication, or how does that work?
That's right, because when you had gestational diabetes, you go under a consultant, and a nurse, registered nurse, and they would keep checking your blood sugar levels, and they would carry on doing it once you've given the birth as well, just to make sure that, it's over and done with, or you're still continuing to have it. So yeah, so they will do regular checkups for you and the blood sugar level tests as well, just to, to make sure that, it's over, or you still have it, or you still need to be on medication for a specific period of time, or they will just say that, it will just stay with you for the lifetime. But again, at that point in time, I would say if you're on insulin and any medication, just speak to the nurses. If you want to make any changes in your diet and lifestyle, you can work with them along with your nutritionist as well. It's always best to work with a nutritionist or a registered dietitian, when you're working with your GPs or your nurse, because they would not focus too much on the diet and lifestyle side. They would focus on the medication. So if they work all together, then that would be beneficial for you, and they would keep each other in loop as well of what's happening, you know, with your medication or your changes in your blood sugar levels and stuff.
So I was looking through your website, and could you just tell us about the services that you offer?
Yeah, sure. So I do a lot of work around nutrition consultation on prevention of diabetes as well. So if somebody thinks that it runs in my genes or it runs in my family, diabetes or heart disease, I want to just prevent it at the right age so that I don't develop it. I work with those people for the prevention. If somebody's already got any health condition like hay fever, intolerances, diabetes, specifically type 2 diabetes and pre-diabetes, I work with them as well. If women have got any hormonal imbalances, so things like perimenopause, menopause, PMS, fibroids, things like that, I work with those women as well. I do a lot of corporate wellness work where we conduct workshops in the companies or even online workshops like we're doing these days on specific topics like gut health, healthy eating, or just, you know, like being physically active and how to maintain your energy levels throughout the day. So things like that. And I also do menu planning as well. So sorry.
That's okay.
So if you want to plan much in advance and you just need help with that, so pre-planning your meals, also help with tips on grocery shopping, so things like that. Yes.
So what stages would someone go through if they came to you? So I know I looked on your website, you've got different packages and you also have like consultations. So what's the process?
Sure. If somebody comes to me with, if they've already made up their mind that they want to go for weight loss programs, because I do 12-week weight loss program, or I do metabolic detox for a week or 2 weeks, or a gut rehabilitation. So if they just choose the specific packages that I do, then they can just contact me through email. There is already a questionnaire on my website that they fill in and they send it to me, and then we start working, and it's just one package that we do. And then I see them, you know, like see or do a telephone consultation for them within those 12 weeks, 1 or 2 consultations. So that's how that process works. But if somebody comes to me for a bespoke plan, then they contact me through either the telephone or through email. And then I will first try to gauge what is it that they're looking for. So somebody says that, because I practice functional medicine as well, and functional medicine is basically a scientific based approach that looks at the triggers and the mediators that's causing the problem. So I'll try to find out, you know, what's just like a short interview kind of a thing for 10 minutes, just what's causing the problem, what actually is the problem, and what is it that they would want me to help them with. So what are their health goals, just to gauge that. And then I'll send them a few questionnaires to fill in, which is a detailed health questionnaire, which will give me an idea about their medical history, their past medical history, the current medical situation, the family medical history as well. If they are on any supplementations, what's their diet looks like, what sort of lifestyle do they lead, and, you know, like any stress or how well are they sleeping. So all those kind of questions in the questionnaire. Also, 3-day food diary. This gives me a breakdown of what they've been eating and what their actual diet looks like. And then depends on different conditions if I've got more questionnaires for them to fill in. So all those questionnaires they'll send to me before coming to me. And once I've received the questionnaires, I will deeply study them and investigate basically from those different questions what could be the cause of the problem. So for example, if somebody comes to me for diabetes, some people think that it's in their genes and they are bound to get diabetes because it's running in the family. But just to let you know that the recent study shows that it's only 20% of genes has the impact on your health condition, and it's 80% is the environment basically. So they say that the loaded gun, what pulls the trigger of the loaded gun is the environment. So don't just think that, you know, it's in my genes, I'm bound to get it, there's nothing I can do about it. there is lots that you can do to control and reverse, because again, it's your diet and lifestyle has a major impact, or any medication that you're taking as well. So I gauge all that before they come to me. And once they come to me, I will have a detailed consultation with them to find out more about those questions and the answers that they have written. And so before they go, we will mutually decide on a plan that they're happy with. And so that, because obviously I don't want to send them with any plan that they think, let's see, if I've got somebody who's come for the gut rehab and I say you need to go on an elimination diet, but they're not happy with it, there's no point sending them with something that they're not going to work on, or they're not happy with it. So obviously I need to have a mutual buy-in, that, you know, that whatever I'm suggesting, if they're happy with it, they're going to use it. So that's what we do. And then once they've gone, I do a detailed plan for them, and I'll send them the plan, and I'll follow up with them in about a couple of weeks just to see how they're getting along with the plan, if there are any changes that I need to make, if they think it's not working or it's working fabulously well, they're doing whatever I've told them, which is the first step, then I move them on to the next step. And then I will again do regular follow-ups with them until we have reached the health goal that they came with, and they're happy with the outcome.
Now, you mentioned functional medicine. So before we move on, can you just tell me what functional medicine is?
Sure. So functional medicine, I've mentioned, is basically a scientific-based approach that works to find out the triggers and mediators that's causing the problem. So that goes to the root cause of the problem. So we don't just see the surface of the problem. Somebody's got diabetes. Yes, it's running in my family. That's fine. You're bound to get diabetes. There's nothing we can do about it. But what is it? Because 80% of the environment has the impact on your health condition. So I need to find out what's happening in the environment. You know, is it too much stress? Is it you not sleeping well? Or your diet is really bad, too much saturated fats or processed foods, or, you know, like you're not physically active. So I just need to gauge, you know, what's your environment like, which is what functional medicine focuses on, so that we can find out what's causing the problem. And then we go and, you know, look at the root cause and then start managing the symptoms initially. And that should help you in managing your the current problem that you're facing.
Because potentially when we're talking about diabetes, it could just be all down to one thing, or a mixture of all three things. So it could be that you're just really stressed out, and you know that could just be one of the problems, and you might be trying to eat really well and you might be trying to do the exercise, but it's the stress that's pushing it. So then you would help them in that sense.
Absolutely. So we just find out the trigger point. What's the trigger? What's pulling the gun, basically, the trigger of the gun. So that's what is important. As you rightly mentioned, you could be doing 10 different things, which are absolutely fine, but there's one thing that we need to find out that's causing the symptoms, basically.
Perfect. So for anyone that's watching this now, where can they find you? What's your website, and how can they find you on social media?
Sure. They can visit my website, which is www.nutricientist.co.uk. And I've also got my email address and contact number on the website, so they can directly call me or contact me through email address as well. They can find me on different platforms like social media platforms, Facebook, Instagram, LinkedIn. It's all by the name of Nutrilogy Health again. So yeah.
Perfect. Thank you so much for joining me today. And I'm sure that you'll be joining me again soon to talk about other things that you also work on.
Thank you so much, Melissa, for having me on your show. It was my privilege. Thank you so much.
You're welcome.